like Mike said, it's a very small, little, tiny bill that's going to cost, according to the fiscal analysis, $400 billion. But in our estimation, it's actually going to be much higher than that. Because, well, let me backtrack. So SB 562 is the single-payer government-run healthcare program. It eliminates all private health insurance. It eliminates employer-sponsored insurance. And so it would be publicly funded, but it would be provided by private hospitals and physicians. It would take us back to a fee-for-service model instead of trying to move towards a managed care, treating the patient as a whole and making sure they're well, rather than just paying the doctor when the patient is sick. And so it would cover every resident in California, regardless of immigration status, and it would eliminate all cost-sharing, co-pays, premiums. There would be none. It provides so many benefits I can't even name, but it would include dental, vision, chiropractic, acupuncture, and even the medical care that it would provide. Currently, you have to have medical necessity. Under the bill, any medically appropriate care would be provided. So essentially, it provides the moon and the stars without without requiring a copay. So it's going to dramatically increase healthcare costs because it eliminates consumer awareness of what healthcare actually costs. Because when you have a belief that something is free, you may overutilize it, and that's what will happen under this system. So those are the flaws of the system in and of itself. But as far as the cost, that is one of our greatest concerns, because past legislative attempts have always required a significant payroll tax on employers. And so the fiscal analysis, the bill is currently silent on the funding mechanism, but past attempts have required a 16% payroll tax. The fiscal analysis this year says that a single-payer system would cost the state $400 billion and require a 15% payroll tax. Our estimation, and the reason I say it will be significantly higher, is because they're calling this a Medicare for All system. In California, we spend $13,300 on Medicare beneficiaries per beneficiary. And so if you really wanted a Medicare for All system, you would multiply 13,300 by 39.14 million people, and the number you'd end up with is $522 billion. And so even assuming that it would cost a little less because it's not all elder community, you're still looking at, because currently we only have public funds of $260 billion. That includes federal and state funds. And this is assuming that we would even get the federal waivers. And that's very uncertain, because I don't know why the federal government would be so willing to grant us those waivers. But even assuming they did grant the waivers, we still have other hurdles, because federal ERISA laws would need to be changed. Federal Medicaid application laws would need to be changed. And so, but even best case scenario, they grant the waivers, we get all the money. We only have $260 billion to work with. And this system is realistically, if it's a Medicare for All system, is going to cost $522 billion, and even on the more conservative estimates, $400 billion. And so it's a significant tax on employers, and it would burden the business community to such a degree that we would likely lose jobs in California, and that's why it's a job killer, and significant jobs. And also, it would be a disincentive for business to come to California. So I think when you're over there today, I think this is a very important day for you all to be here, because this morning, Senator Lara held a press conference at 9:30, and they talked about the unofficial funding plan, so it's still not in the bill, but they're recommending a 2.3% sales tax and a 2.3% tax on businesses. And so, again, when we do the numbers, those don't add up. I think it would be much, much higher, and we'll be analyzing those numbers, but the study just came out this morning.